Glycated hemoglobin test. Glycated hemoglobin test. The glycated hemoglobin test stands for a glycated or glycosylated hemoglobin test. This test helps measure average blood sugar levels for the past 3 months. This test is essential for every person who has diabetes. Other names of this test are glycohemoglobin test, A1C test, or simply A1C. Hemoglobin is the protein in the red blood cells that help in the transportation of oxygen across the body. Sugar, or glucose, present in the blood combines with one type of hemoglobin, Hemoglobin A. This combination molecule is called glycated hemoglobin. A red blood cell lives up to 120 days or 4 months. Hence, measuring this combination molecule gives a fair estimate of your blood sugar levels in the last 2 to 3 months. Keep your diabetes in check with a glycated hemoglobin test. Importance of glycated hemoglobin test. Do you regularly measure your fasting and after meal blood sugar to keep a check on your diabetes? Think that is enough? Not actually. Though fasting and post-meal tracking of blood glucose is important, these tests can only check your blood sugar at a certain point of time. Their results might vary depending on what you had eaten over the last night or in the previous meal. However, the glycated hemoglobin test looks at the 3-month data and cannot be biased. For persons having diabetes, glycated hemoglobin numbers give a fair idea of how controlled their diabetes is. As per scientific evidence, having a smaller glycated hemoglobin number means a lesser risk of developing complications due to diabetes. All raised glycated hemoglobin value has also been regarded as an independent risk factor for heart disease and stroke in people with or without diabetes. Why is the glycated hemoglobin test was done and what significance of it? The glycated hemoglobin test is used for diagnosis as well as monitoring purposes. Your doctor suggests a glycated hemoglobin test to see whether your diabetes is controlled or not. Pre-diabetics, people having borderline diabetes, are also advised to get tested to check how stable their blood sugar levels are. All diabetic patients should know the significance of the glycated hemoglobin test. Frequency of getting tested. In general, people having diabetes and pre-diabetes should get their glycated hemoglobin tested every 3 months. If you are healthy but have a family history of diabetes or think your lifestyle makes you prone to develop diabetes, you should get a glycated hemoglobin test done every 6 months. You can consult a doctor on how frequently you should take a test for your health condition. Glycated hemoglobin results. The results of the A1C test are presented as a percentage. The test result shows the amount of hemoglobin that glucose has bound to in your blood. For diagnostic purposes, the test results may be as follows. 1. Normal/healthy, below 5.7%. 2. Prediabetes, 5.7 to 6.4%. 3. Diabetes, 6.5% or more. There are certain factors and some medical conditions that can change the glycated hemoglobin results slightly and even lead to a higher reading. Some conditions that can cause a false A1C number include 1. Liver disease. 2. Kidney disease. 3. Recent blood loss or transfusion. 4. Low iron levels. 5. Certain blood-related conditions. Your doctor is the best guide to analyzing the results. Glycated hemoglobin target levels. A healthy person who does not have diabetes should target a glycated hemoglobin score below 5.7%. If a person has a glycated hemoglobin score of 6.5% or higher, it's likely that he/she has diabetes. During treatment for diabetes, different people will have different targets, based on factors such as their age and the medicines they are taking. In general, diabetics might be asked to keep their glycated hemoglobin result below 7%. Older adults having diabetes and diabetics who might also be at risk of low sugar levels, hypoglycemia, can be recommended a glycated hemoglobin number of around 8%. Test preparation for glycated hemoglobin. Unlike fasting or post-meal blood sugar tests, no special preparation is needed for a glycated hemoglobin test. You do not need to fast. You can give a test sample at any time of the day. Also, do not miss your medicines on the day of getting tested.